I think when you get into specific cancers on the head and neck, basal cells and squamous cells the most commonly done, Mohs surgery becomes a very common treatment choice, and that's become the big buzzword in the skin cancer arena across the country. All these celebrities and athletes are all having their skin cancers pop up, and you'll see them getting their cancers done. I think that Brian Williams, or one of the guys, they did his Mohs surgery in New York City live. And so I think you're seeing that becoming kind of the commonplace treatment, and it definitely is indicated in a significant number of those cancers. Probably not in every cancer, and it might be overutilized in certain situations and probably underutilized in others. But it's a very good technique in physicians that are, have skill set to handle those cases, where they go in specifically targeting that location, sparing as much of good skin as possible while the patient waits. That tissue is examined through frozen sectioning and through certain processing, evaluating the margins, peripheral or lateral margins, and the depth margins of that tumor, and distinguishing with pretty good margin control that cancer is still present or not, and then they continue to take out the skin that's no longer viable, infected with cancer, until you get clear margins. So you utilize that technique, you often will afford a very high cure rate with that patient. You're probably looking at 99+% for basal cells and 99 to 97% for squamous cells. So for patients, when they get those statistical odds versus 90% for scraping and burning the cancer out, they always are going to choose the 99%. It's an easy sell for that patient. Now, sometimes it still might not be the treatment you need to do. You might sit there and go, okay, well, I can do 99.9% cure on that small basal cell on your shoulder, but I can probably get 90+% and really probably higher than that by doing a 2-minute ED&C procedure. So it's up to the physician to distinguish to the patient, because they entrust us, in our opinion, to what's the proper treatment. I think Mohs surgery, though, becomes a very excellent choice in a lot of situations. And so we do a significant number of cases here between Dr. Wilmoth and myself for those cancers.